Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee Bazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for being a part of tonight's Egg Whisperer Show. Today's topic is a topic that's near and dear to my heart because I know all too well how tough it is to be a fertility patient because I live through the fertility struggles of my patients each and every day. I'm so excited to have Dr. Mary Coleman Allen. Hi Dr. Allen.
Hi, thank you so much for having me tonight.
Thanks for joining us all the way from Georgia. Can you tell me a little bit about your practice?
Sure. I have a private practice. I see probably about 95% of my practice is made up of fertility patients. The other 5% would be coming in for general anxiety, depression, communication issues, etc. So I work all with adults. And I love it. I absolutely love it. I have a passion for my work. And it's an ever-changing field, as we know. And it's a passion for me, so thanks for.
And so we talked a little bit about the show before the show started about how you have a fertility story as well. Tell us a little bit about that.
Sure. Had been trying for several years and ended up with numerous rounds of IUI and 5 rounds of IVF, and were successful finally. And we have 16-year-old twins now, which is amazing, and had endometriosis. It's unexplained, so likely some other issues. But anyway, it worked out, and that's why I love what I do.
So what I thought we could do tonight, which I thought would be super helpful, is take families, and when I say families, I really mean, you know, same-sex male, same-sex female, heterosexual, single women, single dads, everybody when I say family. So when we refer to male or female or husband or wife, you and I are all inclusive. So I don't want to feel that anyone who's watching the show doesn't think that we are, you know, practitioners who can help them for sure.
Yep.
Okay?
Absolutely.
Yeah. So let's talk about from beginning to end. So let's say you're about to see the fertility doctor for the very first time and you're feeling super, super anxious. Coleman, what do I do? What would you recommend?
Well, I think it's an amazing thing to actually make the call. People put that off sometimes because they do feel nervous or don't want to be told something that they may have an issue that they weren't aware of or something. So I think, first of all, look at it as a step in the right direction and feel like it's progress. So go in with the idea that you're going to learn more about yourself than you knew before. Mm-hmm. So I'm kind of have a little bit of a scientist brain, so I like data, and I think with every step, with a fertility physician doing the screenings, you're going to have more data and know a little bit more about what direction to go.
And you brought something up, and that just made me think to ask you, as you're going through this, sometimes it kind of hurts your self-esteem a little bit. What tips do you have for, let's say, me, pretend I'm the patient, if this whole process is kind of making me feel bad about myself? What should I do to help with my self-esteem?
So I feel like these are kind of almost primal emotions that can come up for us sometimes going through infertility issues, and whether it's we're kicking ourselves for feeling jealous about a friend who's become pregnant, or we're just down on ourselves because our bodies aren't doing what we want them to do for whatever reason. Again, it's always a family issue, I call it, not just individual issues. But so I try to tease out a little bit between the biology of things and the character. Mm-hmm. So, you know, even sometimes people feel like, gosh, if I made a mistake earlier in life, I'm being punished. And so we try to address that. It's hard not to feel less than when you're going through fertility issues, but if you can look at it more as potentially a medical issue and things that can be, you know, worked on, then it helps with the character side.
Mm-hmm. And then you talked a little bit about relationships, and something I hear all the time is, you know, let's say the female partner says something like, well, my male partner gets all stressed out when I'm ovulating, and no one wants to have, you know, sex on demand or feel like they're just being used as, let's say, a sperm donor if you're trying to make a baby at home. So what kind of tips do you have when you're having difficulty being intimate because all of a sudden sex becomes a chore?
Sure, and that can be on both sides. And if you're, to use your example for a man and a woman in a couple, you know, you're calling, honey, it's time to come home. I'm ovulating. You know, we've got to do this right now. Get home and let's perform. And that can actually lead to performance anxiety when there wasn't any before, for a lot of men that I see in my work. And for a woman, a lot of time, well, for both, but especially sometimes for women, having sex and having it not lead to a baby when that's what you really want, that can lead to a negative association or an association with failure over and over. And then, you know, if you're in treatment and you're taking the hormones and you're feeling tired, and it's a complicated issue, and it can compound based on all of these issues. So I really want people to give each other the benefit of the doubt, and to start back small. Just start back holding hands and taking walks in the evening if you can, and just try to reconnect. You have time to build the sex life up again later, but sometimes it just takes some connection just to be sure you're walking this together and that it feels like a team, and that's a great start. Right.
And I think the fertility challenges, or I should say the emotional challenges of being a fertility patient, aren't just in the walls of a fertility doctor's office, right? Because you go out socially, you're talking to friends, they're asking you questions like, when are you going to start a family? What would you say if that were you, or what would you recommend to one of your clients or patients?
So I feel like, you know, if it's a couple, for example, going through this, you know, that you're the kind of heads of your marital corporation. You decide what rolls out to the public and what stays private within this marital corporation. And this is, you know, you're building a family and you're making a baby, and you wouldn't necessarily be talking about all the details if you were doing this behind closed doors, the old-fashioned way. So you don't owe anyone these, you know, details of what you're going through at the fertility clinic. If it's easier to say, yes, I'm going through some treatment, that's great. If you want to say we're going through IVF, whatever you're comfortable with. But sometimes if people want to support and you know that, but you don't want to tell them about your IVF cycle or whatever cycle you're going through, sometimes you can say, we're getting some help. We're working really hard at this, and we know you're there, and it means a lot to us. And we're going to share when we have some news. So just know we're not going to be talking about this a lot because we want to save our energy.
That's great. And then what about like an employer? You know, there's nothing like fertility treatment where, you know, in a 2-week time span, you all of a sudden need to be at appointments like for over 5 different appointments over that 12-day time span. How do you recommend dealing with that kind of challenge and stress when you have to talk to your coworkers, you know, maybe a boss or manager? How much should people really be sharing about what they're going through? What do you recommend?
Well, I wish I knew a little bit more about current HR information, but you know, if you were being treated for some medical issue such as cancer or something like that, and you didn't want to share that, but you were leaving for treatments, you probably wouldn't worry as much about what you told your boss or what you told your coworkers. I think when it comes to fertility, it's something you want so much that you almost feel guilty, you know, leaving the office or making time for the appointment. And I think it's really important that people give themselves permission to do what they need to do and not feel guilty about it, because this is an area that often needs the help of medical assistance, and it's just as important. And so I think it's important to just let them know you have some medical appointments that you're going to need to be out. And if I don't know that they're allowed to ask much further than that. If they are, you can say, sometimes we'll just say it's, you know, some female hormonal issues, and they tend to back off. So.
See, if it were up to me, first of all, if you're just joining the show, I just want to introduce everybody to Dr. Mary Coleman Allen. She goes by Coleman. She's in Atlanta, Georgia, and we love working with her. She does a great job counseling our patients. But if it were up to me, every patient would be seeing, or, you know, have someone like you coaching them along the way. When do you think a patient should see a fertility psychologist, you know, from your standpoint? I
think it could be helpful from the get-go. there's some people who go through IVF cycles, and they're only when they're required for a donor egg or surrogacy cycle are they required sometimes to come in. And they say, gosh, I wish I could have done this before. And then some clinics require it for IVF and beyond. So, and sometimes those folks will say, gosh, I wish I'd found you after my second IUI. So it just kind of depends. I think each individual person has different coping resources, different, social structures, et cetera, support structures. So, I think don't let yourself get too far down the line without feeling like you have someone to reach out to. You're welcome to ask Dr. Aimee to tap me if you want to, and I can try to get you hooked up where you are. So whatever your needs are, but it is important.
And then, everyone is so busy, especially in the Bay Area with their jobs and, everything that they're doing. How often would you want someone to see you, let's say during a treatment cycle? What kind of appointments are you looking at? How long are they? Tell me more about that.
I think if they were going to see someone for their support, the treatment cycles tend to, if it's an IVF or an IUI, they're kind of bunched in a month cycle. Right. So I think if there's a negative outcome and they need support at that point, reach out. If it's more for coaching and preparation and they're going into IVF, I think that can be very helpful because that's much different than an IUI cycle. It's just much more many more steps, very doable, but just different. Right. So I think for any reason, whether it's communication with loved ones or dealing with work stress, in addition to going through fertility issues, I just think it can be week to week. It can be every couple of weeks or as needed.
So I want to get into some nitty gritty like exercises and tips you might have, because I have patients that they're feeling really emotional, they're feeling depressed, they're feeling anxious. Take me through some coping strategies if, let's say, you're having really anxious feelings and your retrieval is tomorrow. What can someone do so that they don't suffer from, let's say, a panic attack?
Yeah, so feeling nervous, first of all, about retrieval, I think can be helped prior to that by talking to someone, a nurse, someone like me, who can just say, look, this is a very doable process, and kind of walk you through the steps. Emotionally and how it feels, but just taking some very even brief moments, just a few minutes at a time, and practicing some mindful meditation can help, which would involve some different types of exercises, but one might be closing your eyes and taking 3 very slow deep breaths, 3 or 4 very slow deep breaths, and opening your eyes and just focusing on what's in the room, color, sound, texture of what you're sitting on, that kind of thing. And it just sort of slows the mind and brings it back into the station, I call it, from runaway train. Taking a walk around the neighborhood, listening to some great music, just doing some soothing activities that can distract your mind away from the worry and bring yourself into the moment, and just know you're going to get through the retrieval just fine.
I have a lot of patients that tell me about adult coloring books and how those can sometimes help really focus your attention away from kind of what's going on and what you're worried about. So that's another tip someone gave me. They're
wonderful. Sometimes so coloring books are amazing, and there are tons of them out there now that are really intricate and beautiful. Some people who knit tend to take the knitting needles wherever they go and just knit because they're just nervous and they're just using that. People tend to craft, maybe make a pretty craft. Some people like that completion, in a night. So different activities for different people to bring them more into the moment and bringing their, just soothing their minds.
And I think that's a good point. Like, I try and take my patients through everything start to finish, just like you say, so they can visualize what's going to happen. They're going to check in, the nurse is going to meet with them, someone's going to place an IV, you'll get dressed in a really fancy gown with a beautiful hat, and you'll have your butt hanging out in the back. And you'll be the only one in the room like that. I will not have my butt hanging out in the back during your egg retrieval. So I always try to bring humor for sure, but some people are still nervous. And so I do prescribe a medication like Valium for someone to take the night before the egg retrieval, and even with obviously permission of the anesthesiologist always. Something like that, maybe 3 hours before the egg retrieval with a tiny sip of water. That can sometimes really help if you're feeling super anxious, because I want patients to get a really good night's sleep the night before the egg retrieval for sure. And then at what point, I I would say probably 25% of my patients are taking some sort of medication for depression, and some people aren't, and they're wondering if they really need to. Do you make those kinds of assessments and say, hey, I think you need to see a psychiatrist? Can you tell me, like, just real quick, like, what kind of things do you look out for where you say, you know what, I think you need to now not just see a psychologist, but also see a medical doctor who can prescribe something a little bit, just prescribe something and I can't?
Right. So I do try to assess what can be, and I try to look at things through nutrition, through environmental shifts that people can make, what's within your control to shift so you can become a little bit less anxious.
Right.
And yes, medication sometimes is needed. I mean, we need mom or dad to be healthy and feeling okay to go through this, and this is a lot on top of, you know, a regularly full plate. So in those cases, I do refer to a psychiatrist who is well trained in fertility issues and can work with the patient through a low dose of whatever it is that they need.
And you brought up nutrition, and that's really important. So eating right, diet, exercise, sleeping, and I tell patients, you know, I want you to socialize. I don't want you to isolate yourself. And there's so many ways of socializing. Finding the right types of support through online groups is another way, so you don't feel like you're alone. Sharing your story, maybe you're not open to sharing it to everybody around you, let's say, you know, to everyone you meet, but if you're sharing it in more of a private setting, perhaps you'll also receive support that way. And then and all over the country are Resolve support groups where you can meet with women in your community to kind of share your story and also get support that way as well. I'm sure you guys have support groups as well in Georgia.
Absolutely, and Resolve is an amazing, amazing resource, and I see clients who have connected with surrogates through that, or just have had, you know, an amazing experience. I went through Resolve when I was a patient, and it helped tremendously because it is a very isolating experience, and these groups are great. Yeah.
So now, one of the most stressful parts of being a fertility patient is the 2-week wait. You know, it doesn't matter what treatment you're doing, whether you're doing IUI, whether you're doing just timed intercourse or IVF, waiting to find out if you're pregnant or not is just an emotional, like, roller coaster. Every single cramp you feel, you know, every single thing you smell, literally, you feel like you need to go to the internet and Google it and say, is this a sign of pregnancy? So what did you do to cope during that time period when you were going through this? And what do you tell your patients? How should we be guiding people?
I think, I've learned a lot about how to cope even since that time when I was going through it. And I was very stressed, extremely stressed. And so now I try to work with people so that they don't feel like that, because it's not a good way to feel. And I think preparing folks that it's, you know, this, once you get a transfer, you can be taking your you will be taking your progesterone every night. But other than that, you're not really active in the process. You can't make it happen any faster, nor can you make time go by any more quickly.
So you've done everything you can up until that point. That's so true.
Everything. Yeah, because the first half of a cycle, you're a little bit more active, showing up for appointments. In the waiting phase, it's harder emotionally because you're just waiting, and there's nothing you can do to control anything, right? You're just waiting for nature to do its part. So distraction is a great thing. And again, you know, I try to tell people, you know, you're going to have regular life stressors. You can't live in a bubble or under a little glass dome going through this process. You're going to be at work or, you know, with friends, driving in traffic. So if you do have someone who cuts you off in traffic and you feel that adrenaline surge and you're worried that you've hurt your embryo because you've felt nervous for a minute, I mean, that's a fight or flight moment, right?
Oh, I get those calls or emails all the time. Like, my dog sat on me, or I actually had to lift something. Did I hurt, you know, my chances? And now you're an emotional wreck.
So trying to prepare them not to feel like that when something like that does happen is really important, because life stuff is going to happen along the way, and their body's going to protect their little embryo. But
their body's going to protect their little embryo. I'm going to use that from now on.
Okay, well, awesome.
Folks, your body's going to protect your little embryo. Don't worry. You're not going to pee it out, poop it out, barf it out, laugh it out, unless you're watching the show.
That's right.
Your body's going to protect it.
And I know that people are, you know, told to pull back a little bit if they are hardcore exercisers, right? Just to put it within some sort of parameter that you recommend. So in that, taking walks in nature that's a beautiful exercise, very therapeutic. Also gets you moving and gets the blood flowing, but you're not hardcore, you know, if you're not used to that. Talking to supportive friends or a therapist or because a lot of times for women going through this, typically, and again, I don't like to stereotype, but a lot of times women tend to need to talk more. And if they have a male partner, typically that person does not talk as much with friends about the fertility process. So it just depends, again, on the setup of the family. But talking about it can be helpful, and also practicing that mindful meditation. So doing the deep breaths, and there are apps for that, for relaxation strategies, and certainly available to you on your phones.
For sure. I ask patients to pick a mantra, and one of the ones that I love, and a patient taught me this, is that you're going to have a baby one way or another.
That's right.
And you've literally, like you say, you've done everything you possibly can at this point, and it's out of your hands. And that's just kind of calming, It just means that something wonderful is coming your way. It may not be right now, but it is going to come.
Absolutely.
And for me, it's just letting my patients know that I'm not going to give up on them. With whatever issues they have, we'll always just keep talking about what we can do to help them have a family. And I can't help everybody the way they, initially wanted, and that might be their own eggs, their partner's sperm, their own uterus. And, I've helped so many families go through the process just to realize that adoption was the best plan for them. And they wouldn't have known it had they not gone through the process of being a fertility patient first. And so just, staying, it's easy for me to be positive and just always be supportive. And I totally get when patients are extremely emotional, and I certainly allow them to just share their emotions with me so that I can hear how they're feeling, so that I can guide them appropriately toward the next treatment plan for them. Okay, so now the hardest part of being a doctor, especially a fertility doctor, because we tend to be really like happy people and we want to help people. And some of the hardest calls for me to make during the day are that negative pregnancy test. Luckily, with advanced technology, genetic testing, especially with IVF, I'm not making those calls as often, but I would say in a given week, I do have to let maybe 1 or 2 people know that their pregnancy test is indeed negative, and I can hear the heartbreak. I mean, I can hear the tears. I mean, I'm feeling it inside my stomach when I even think of making these calls. I dread them. How do you get through that as a patient? What do you tell your patients?
I think it's really hard to forecast how somebody's going to feel if that happens, especially if they've gone through treatment before. Sometimes a partner will say, I just can't see my partner go through this again. How are we going to prepare if it's negative? Right. And I think kind of getting the support in place just in case you do need it is important. Approaching a cycle with cautious optimism is important, keeping a little bit of your heart on reserve just in case you need to bounce back. Knowing, again, just like you, sharing with my clients that you will build your family one way or the other. If you want a baby, you will achieve that in time. So just know that there are options. But I think it's, for some people, they need a plan B and a plan C, and other people only want to focus on the moment. So it really kind of depends on who you're working with at the time.
Right. And I do like to talk to my patients about, well, this is kind of what we would consider if this didn't work. These are the chances of pregnancy. And then if there is a negative pregnancy test, I'm always bringing people back in to kind of talk about what we learned from whatever treatment we just did, so we can see what we need to do differently to hopefully improve our chances next time, if that's in our future. And then the joy of being a fertility doctor certainly is also helping people get pregnant with a positive pregnancy test. But not everybody stays pregnant. And I don't mean for the show to be all, down and out, but the reality of being a fertility doctor is that not everybody's story is full of like rainbows and puppy dogs and whatever, unicorns, right? So the miscarriages are emotionally challenging as well. I really hope that all my patients who deal with that also see a fertility psychologist. But emotionally, what do you see in your patients that you think we could learn from as far as like what they can do to cope with that sort of diagnosis?
So in the case of miscarriage, or even for some people a chemical pregnancy, if they've never been pregnant before, you finally reached it. I think if well, and you have, of course, single people going through treatment as well. If you have a supportive partner or a support system, it's a lot easier to get through a situation like that. However, we also know that even with a partnership, people can move forward as far as healing at different rates. And so I think it's important to talk to the couple about, how do you support each other through something like this? I mean, when they come in to see me after a loss, it's 2 steps forward, 1 step back often, because you start to feel better, and then you see someone who's recently had a baby and it comes back. And so it's hard, and I can't take the pain away. A lot of times it's just, it takes time and knowing you can focus on something else, whether it is another treatment cycle or starting the adoption process or, just taking a break. So I think taking care of the support system is really important. And certainly starting to heal from a physical standpoint as well.
Yeah, and you brought up a good point, taking 2 steps forward, 1 step back, seeing someone have a baby, and then how that makes you feel emotionally. I mean, I call it pregnancy envy, baby envy. It is real, and even if you have your baby through fertility treatment and then you see others with children or babies, you sometimes actually feel that. What do you say to people who talk to you about pregnancy and baby envy and how they should deal with those emotions, especially if there are social situations where they're being invited somewhere, like a baby shower or a first-year birthday party? What should they do?
So if they're actually going through the process of treatment at this point and they're dealing with those emotions, I say, look, you can beg out of any of these, or if they've had a loss, you can drop a gift by the door, or have a friend drop the gift off and say, I'm not feeling well. I'm sorry, I'm not going to be at your shower. Just know I'm there in spirit. You don't have to give an explanation. You just do what you feel needs to be done, and you can take the time away if you need to. So don't feel like you've got to go to every party, every social engagement, and certainly not every baby shower. You can still do it in a way that lets your friends know that you care.
And I ask my patients that the only baby shower they're allowed to go to, doctor's orders, is their own. Because I see how much pain this causes women, and I know men wouldn't go to a party that they didn't want to go to, right? But as women, we're just so used to saying yes, and it's so difficult to say no. So that's just one tip I give people. And I think that it's almost a primal emotion that comes up when you feel the jealousy or you feel the anger or whatever it is that people feel guilty for feeling because they are going through infertility treatment and haven't achieved what their friends have achieved or the person next to them in the office has achieved. And I just tell people, don't blame yourself for feeling these things. Just know that'll pass. You're in this time frame you're gonna pass through it, and you're not going to be in this emotional space for much longer. But it's almost a primal emotion. Just notice it and move on. Don't blame yourself for having it. Perfect. And I just want to touch on 2 topics before we end the show. And you brought up something that reminded me of what I really want to talk about. That's blaming and blaming your partner, and the situation where potentially your partner is not quite on board with fertility treatment, whether it's you haven't had any kids and you've been married for, let's say, 7-8 years and he's still not ready yet. I've actually seen it the opposite direction too, where the husband really wants a baby and the wife doesn't. That's also a difficult situation. Or you have one child and he's just not on board with being, ever so present for the journey for number 2. So what does a patient do in that situation where your partner is not quite on board? I think that's a pretty critical or important juncture for counseling. So because when partners are not on the same page as far as what to do next, it's really hard to communicate effectively. And you can't make these big decisions when you're not communicating effectively. So sometimes I suggest, again, to the marital corporation analogy, it's like getting the big whiteboard, making the pros and cons list, and see, how this starts to feel for your marital corporation. What are the pros of moving forward? What are the cons of moving forward? And normalizing the fact that they may be on different pages, and that's okay as long as they can come to agree in time. I would hate to see that lead to further relationship issues. So that's where I think counseling can be really important, and your nurses and you are front lines for that. Yeah, I mean, that's true, but do you really think counseling helps? I mean, if you really have a partner that's not on board, do you feel like you've been in that kind of situation, like where all of a sudden the partner's like, oh yeah, now I've done counseling. I mean, I'm being totally honest here, and I'm ready to be a part of this. Or do you find that the counseling is more for the other partner to realize, hey, your partner's really not on board? So what do you find?
I think it's both. I've seen both, and I've seen a fair amount of both. So I think that sometimes normalizing the situation, talking with them through the communication differences and the different points of view, so that it's not so emotional, or that there's a third party, me, who can diffuse that emotionality and just help them listen to each other in a different way than they do at home when they're arguing in their kitchen about this stuff, and not shutting each other out. They actually have to talk in the office. So sometimes it is just, this is how it's going to be and how you all move forward. And then sometimes partner who's not on board says, you know what, I think I can do this now.
Right. Okay,
so
that's good to know. That's good to know. One last kind of area of psychology as far as being a fertility patient that I wanted to talk to you about is being an egg freezing patient. I think people are so shocked and surprised when I say that being an egg freezing patient is very emotional, especially because a lot of times you're alone. You know, maybe you've told your friends or your family that you're going through this, and maybe there's a lot of judgment still about it, that you're going through it. You don't have as much support around you. People just may not understand why you're doing it. And then there's this expectation, or there's this idea out there that egg freezing is insurance, and then it's going to work, and then you can delay your childbearing, and then there are unmet expectations. So do you do these types of fertility preservation consults as well? Yes, I do. And sometimes it can be just because they want to freeze and preserve, because they just aren't, their eggs are good, they're young enough, and they just have time to do it. Other times it's because they're getting ready to undergo, cancer treatment or whatever it may be. So yes, I do see people prior to an IVF cycle for egg freezing for whatever reason. And, just like with any other patient, some people are more upbeat about it. Some people are nervous about it. I think the dynamic is a little bit different in that they haven't been trying for a long time to have a child. So there's not that underlying kind of anxiety that comes in with fertility treatment, right? Because if you weren't a little bit anxious about not having a child, you wouldn't be in the fertility center. But for egg freezing, depending on the age, that might also be a little bit challenging. Like if they've waited to sort of the cutting edge of where you would say, oh, I don't know that this is going to be the right age. You don't want to get people right where they're feeling pressured. Right. That's so true. And then the emotions or I would say that the fertility drugs don't often help your mood, help your self-image or your self-esteem with how you feel on the inside either. So it can definitely affect you, make you feel depressed when you're not used to feeling depressed. And those emotions are real and something that fertility preservation patients should be aware of, and how to cope with that when it does certainly happen. If it happens, hopefully it doesn't. So Coleman, Dr. Allen, thank you so much for being on our show. I'm going to just check with my producer right now and see if we have a caller. I'm just going to look over here to see if we do. Nope. Nope. We do not have any callers tonight. I just wanted to say thank you for everyone for joining us. Please join us for our next Egg Whisperer show, where we're going to talk more about miscarriages and recurrent pregnancy loss. Dr. Allen, thank you again. Have a great night, everybody. Thank you so much.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee,
And you have yet another success story
just launched by an East Bay fertility doctor.